Oh, look at that. So I'm learning these things.
You know, we were told to prepare ourselves for the worst.
15 months, I think, before they actually put her onto the transplant list.
I was so scared actually going to sleep that I was never going to wake up again.
I worry that she's not out of the woods just yet.
So
I understand
I am
gas
going
heater that
to
exploded.
When I climbed into the ambulance and saw his face and hands.
react to this show. It is ICU season 1. And from an intensive care perspective. So I'm still learning this. So let's take a look.
I was convinced he
So just a little bit about me. I'm an intensive care doctor. We're certified in both internal medicine and critical care medicine. Hello. So this is a test run.
would die.
The sickest patients.
All right. So this is a trauma case. Trauma is a surgical disease, and as a result, a lot of it is going to be taken care of by the surgical intensivist. I'm a medical intensivist, but I do consult on surgical cases.
Me?
"21-year-old Jacob lives life to the full.
Live life to the extreme. Yeah!
But
So this is in Australia.
2 days ago, Jacob ran head-on into a truck.
Okay, so let's start right there. Head on into a truck. So when you have a trauma case like that, you get very concerned. My concern is what was the velocity of both vehicles, because this is where physics really takes over. If you recall from physics, Newton's 3 laws of motion: an object in motion tends to stay in motion until it is acted upon by an outside force. And so in a car wreck, there are actually 3 crashes that occur. The first crash would be the vehicle versus the vehicle in this case. The second crash, because you are still moving, just because the vehicle stopped doesn't mean that you stop. You hit into the vehicle, and that's why we have seat belts, to prevent us from hitting into other objects. And that's also why we have airbags, to kind of, slow down our velocity without destroying things, especially on the inside of us. And then finally, your organs against your skeleton. So there are 3 crashes that actually occur in a motor vehicle accident. So that's the first thing I want to know. What was the velocity? Second thing I want to know is, did he require extrication? So if he required extrication, that means that there was enough force to not allow him to open the door. I would also like to know if there was a death in the same vehicle. That means that there was enough force to kill someone. And remember, he's going to be exposed to that much force. The next thing I want to know is, was the engine in the passenger compartment? Again, if there's enough force to push that engine into the passenger compartment, then the damage on the inside of him is going to be a hell of a lot more. Next, I want to know, we're going to start from the head and making our way down. Was there spidering of the windshield? Spidering of the windshield is when the head goes into the windshield and it actually spiders, because at that point I'm looking at massive head trauma. I'm looking at facial fractures, but more importantly, I'm looking at a traumatic brain injury. It could be a brain bleed. Does he need to go to the operating room immediately? Does he need to get a craniectomy? Does he have to have burr holes? In addition, right, if you think about it, so I'm going to kind of turn this way, right? When you hit, you hyperextend your neck. And so we could be talking about, and then so that, remember, an object tends to stay in motion. So you're going back, and now, the car is going to push against you because equal and opposite, and you're going to go like this and hyperflex. And so you can get spinal fractures. You can get cervical fractures. You can get intrusion into the spinal cord. You can actually get spinal cord lacerations. You can get contusions that cause one called neurogenic shock. It can cause paralysis if you bisect the spinal cord, especially if you cut it between 3, 4, and 5. You're not going to be able to breathe. Remember? C3, 4, and 5 keep the diaphragm alive. That's where your phrenic nerve comes out on either side. That controls the diaphragm. So work here. Okay, what kind of facial fractures? What kind of fractures in the oral area? Because at that point now we worry about an airway. We can be worrying about a obstruction of the airway. Are there teeth that are going to be heading into the trachea that'll obstruct the airway and cause an airway, can cause a pneumonia. With the hyperflexion, hyperextension of the neck, is there any tracheal damage? Is there any lacerations of the major arteries leading to the brain? Any orbital fractures, any nasal fractures, jaw fractures. Again, now we're talking airway. Can they put it in a tracheal tube, or does it need a trach, an emergent crike or emergent trach? And then we kind of come down here, we're looking at the chest, if he went forward. So then is there bending of the steering wheel? If there's bending of the steering wheel, that means there could be chest trauma. If there's chest trauma, we can be looking at fractured ribs on either side, pneumothorax, which is a puncture of the lung and collapse of the lung. Could there be pulmonary contusion? And then those are on the sides. And then, in the middle, obviously, we're worried about the heart. Is there a fractured sternum? Are you worried about, a hemopericardium, so there's blood within the pericardial sac, which can then become tamponade? You come down even further, you start getting into hollow organs. Is there lacerations of the liver, the spleen, the stomach, the bowel? So then if we move down, what kind of trauma are they in the hips? Because again, he's going to be coming up, he's going to be hitting into the dashboard potentially. Do we have any hip fractures? Where was the truck? Was the truck mainly on the passenger side? Was it mainly hit on the driver's side? What kind of fractures do we have of the extremities? So all of these things are what's going through my mind as I hear this. Basically, as soon as he hits the emergency department, he's getting 2 large bore IVs and he's heading for CAT scan right after he gets intubated. If he wasn't intubated in the field, let's keep looking.
He's now in the trauma pod in the Alfred's ICU after doctors.
Okay, so let's take a look at this. So right here, clearly he was intubated. I don't know if it was in the field. I don't know if it was in the operating room by anesthesia. I see a lot of swelling over here. I see cuts. I see blood here. Looks to be sutures. So I don't know if this is a lac. I don't know if there was a frontal bone fracture. You want to look around his orbits for any signs of raccoon eyes, behind the ears for battle signs. Well, they tie there in the tracheal tube. I see a central line over here, and probably because of the Philadelphia collar, I would say it's probably a subclavian line. In addition, with a Philadelphia collar, it seems as though they didn't clear the cervical spine, or they did something there. This is someone I personally would not intubate. I'd call my anesthesia colleagues to come and do the intubation.
Worked for hours to save his life.
Okay, so they worked for hours. I want to know, was he open? Was he closed? Was his abdomen open? When I get sign out from a surgeon, I want to know exactly what happened. I want to know if you needed to open the abdomen, invade into the peritoneal space. I want to know for how long was he open. I want to know whether or not he developed any kind of shock. Is he making urine? For every hour that belly is open, you lose a liter of water, of fluid. And as a result, he comes in tachycardic. I don't know if he's in pain. I don't know if it's blood loss. I don't know if it's intravascular volume depletion. I don't know if he's paralyzed but not sedated enough and he's got awareness. I don't know if he's hypoxic. Could be a whole lot of slew of different things. So I need to know, how much did he get resuscitated? How much fluid did he get in the operating room? Did he get any blood? And we're actually going to see in a minute. He got a lot of blood.
Jake is a young man that was involved in quite a serious motor car accident, and he suffered multiple injuries.
Let me see what else is going on here. Anything? Well, I see a wrapping here,
Including chest and abdominal injuries and longer bony fractures.
Okay, so chest and abdominal injuries. Basically, he's pretty sick.
Injuries.
Incredibly, Jacob had 20 separate injuries.
Here's a nice depiction. So, the two lungs. I wonder whether or not there's a pneumothorax. Is there a pulmonary contusion? Are there multiple rib fractures on either side? Is there a sternal fracture? Is there a liver laceration? Is there a spleen laceration? Does he still have a spleen? Is there any kind of laceration within the stomach, within the bowel?
Including bruised lungs, fractured ribs, bruised kidney, and cuts and tears of the liver, spleen, and colon. He also had cuts and fractures to his right leg, knee, ankle, and foot, and his little toe was torn off.
So we're talking on the right side because remember the patient is looking at us, so his right is our left, our right is his left. So if everything was on the right, so remember they're in Australia, so they drive on the right, so this was mainly a driver side collision.
The lacerated liver was bleeding so much that half of it had to be taken out.
We had a chance to see the car and
all right, so holy crap. I can tell you right now, he was extricated. If we take a look, the A bar is missing from here. The door is gone. This is just crunched all the way in. This is where he was sitting. The engine is still here, but all of the force needed to cause this damage, rip the wheel right off of rip the tire right off the wheel. This was not a low velocity collision. This was a high velocity collision. And this kid's at very high risk for massive traumatic brain injury.
yeah, I'm in a heart sank. We didn't think we.
Let's take a look at the monitor. The monitor, this is pretty universal. You've got these various numbers up here. So in the green is his heart rate. In the red is his blood pressure. He's got an arterial line, so that's a catheter right in the artery, gives you the most accurate blood pressure reading outside of being right in the heart. It's cath, and so it's 144/71. It's always in red. Then here we have our pulse ox, 100%. So this is the pulse off of the pulse ox, 30. This is probably, judging from what I'm seeing, this actually could be end tidal CO2, not his respiratory rate. 37.3. So he's got a temperature probe. It's either in the esophagus or in the bladder. These people with traumatic brain injuries cannot have fevers. Fever is deadly.
We would see Jacob. So one of the nurses here came in and just told us that Jacob's in a critical condition. We needed to be prepared.
His injuries are like.
All right, so let's take a look at this. So yeah, he's got a chest tube right here. So, you know, he probably had some bleeding in the lung. It looks like he's got 2 JP drains is coming up from the liver. So he's still actively bleeding. You have to keep make sure that you watch that because the patient will become anemic very, very quickly. You're going to have to get CBCs on a regular basis. However, you also have to make sure that you don't do it too often because then you will make the patient anemic. Now, with CBCs rather than H&H, I hate H&Hs because they don't tell me anything. Okay, so I have hemoglobin hematocrit, big deal. What I also need to know is what are their platelets doing? Because if they're bleeding because of low platelets, what we call consumptive thrombocytopenia, you got to give this guy platelets, or else he'll keep bleeding.
Life-threatening, there's no doubt about that. There is the potential for him to have a brain injury. He had massive blood transfusion while he was in theatre.
So massive blood transfusion. They probably had, massive transfusion protocol. Probably gave him whole blood, which would be plasma, platelets, and packed cells. If he had multiple, then he's going to need calcium. He's at risk for developing vasoplegia from the chelation of the calcium from the EDTA of the blood transfusions.
His blood was probably replaced by his entire volume 3 times in the time he was there. They also operated on his leg, and then he was brought to us here in ICU. Mainly his biggest risk at this point is ongoing bleeding and whether we can actually control it.
Been really strong, well done. So proud.
Jacob's parents can see him and touch him, but there is every chance they still might lose him.
So I just kind of want to go back for a minute.
Jacob's parents can see him.
His biggest risk at this point is ongoing bleeding and whether we can, in his time he was there, they also operated on his...
Let's go back just a hair.
His blood was probably replaced by his entire volume 3 times in the time he was there.
Okay, so here's a nice shot of the ventilator. This is an old Puritan Bennett. You know, this is from, I think, 7 years ago. Okay, so basically when you're looking at the mechanical ventilator, you want to look at what's going on here, and you want to look what's going on here. So, you know, this is what you want the machine to do. So you've got the respiratory rate, you've got the tidal volume, you've got the flow rate. So this is a volume control. And so the machine is going to give him what appears to be 500 cc's of tidal volume. So when it's time, the valve's going to open up. 500 cc's at, looks like 60 liters per minute is going to flow right in. The machine doesn't care about the pressure that's going to hit the lung. It's just going to go, in it goes, and then it'll close once it gets you to the 500, and then you're going to exhale. This is the respiratory rate and how fast the machine is going to breathe. Hard to say. He's got a PEEP. Looks like a PEEP of 10. All right, so that's the amount of pressure that's left in the alveoli after exhalation. So it keeps 10 centimeters of water pressure in there. Is that pressure support? So it looks like it might be an SIMV kind of setup where it's synchronized intermittent mechanical ventilation. So it's kind of a mix between assist control here and a pressure support here where you can breathe on your own. So this is what you want the machine to do. This is what the patient is actually doing. So here we have the plateau pressure. So the plateau pressure is the pressure within the entire circuit from the mechanical ventilator all the way down to the lungs. If you want to isolate just the lungs, you want the plateau pressure, you got to do an inspiratory hold. Then this is the rate that the patient is actually doing. Looks like you might be 26 or 16. Hard for me to tell. Well, it can't be 16 because his minimum rate is 20. So probably 26. This is PEEP, and this is his I to E ratio. So for every second of inhalation, he's got 2 seconds of exhalation. This is the tidal volume that he's getting. So, and then here you have your flow volume loop. So, he gets the inhalation, the valve breath is going in, valve closes, he's allowed to exhale it all out. And then before he's given the next breath, he empties up completely and then gets another breath. So that's all I'm going to say about that. We'll continue this another time. This is a test.